Okay, we are live on Facebook. Good afternoon and welcome everyone to a live streamed event with Dr. Iwanenko, Dr. Ghosheh, Dr. Ford, and Dr. Link. I'd like to quickly do a sound check. Dr. Iwanenko.
Angela, how are you?
Thank you. Dr. Ghosheh.
Unclear.
Dr. Ford.
Hello, Angela.
And Dr. Link.
Hello.
Well, perfect. So welcome to a panel conversation on the impact of coronavirus on higher education. Featuring a panel presentation with Dr. Link from Allegheny College, Dr. Ford from Penn State Behrend, Dr. Iwanenko from Gannon University, and co-moderator Dr. Ghosheh from Edinboro University. The outbreak of the coronavirus in 2020 was a major disruption to colleges and universities across the country, with most institutions canceling in-person classes and moving to online instruction. The pandemic also threatened to significantly alter nearly every aspect of college life, from admission and enrollment to athletics. 1 year later, as America successfully combats COVID-19 with vaccination, colleges are at the forefront of demonstrating what is being done to make higher education a safe and valuable experience for millions of students. Some questions to raise include the impact of COVID-19 on learning and education and social interaction as a vital part of college life. What impact did it have on finances, enrollment, and employment on campus? How did each university handle testing, quarantining, and vaccination? Will the COVID-19 experience change education delivery in the future? That is what we'll seek to unpack here with this panel of presenters. Hello and welcome to the Jefferson Educational Society's digital programming. I'm Angela Beaumont and I'm the Director of Operations at the Jefferson. Co-moderator is Dr. Ghosheh, Professor of Geosciences at Edinboro University and Scholar in Residence at the Jefferson Educational Society. Before we dive into the presentations, a bit about the presenters. Dr. Hilary Link is president of Allegheny College. She served for 6 years as Dean of Temple University at Rome and then became vice chair of the American Overseas School of Rome Board of Trustees and a member of the Centro Studi Americani Board of Directors. She also serves on the Climate Leadership Steering Committee of the President's Climate Leadership Commitments. She's a graduate of Stanford University and earned her MA and PhD from Yale University in Italian language and literature. Dr. Ralph Ford is Chancellor of Penn State Behrend. He joined the college in 1994 as a faculty member, where he then served as department chair before he was named director of the School of Engineering. He served as interim chancellor beginning in July 2015 and became chancellor in January 2016. He's the author of more than 40 publications. He holds a bachelor degree in electrical engineering from Clarkson University and master's and doctoral degrees in electrical engineering from the University of Arizona. Dr. Walter Erwinek is Provost and Vice President for Student Experience at Gannon University. Dr. Iwanenko was named Vice President of Academic Administration at Gannon University in fall 2016 and was named Provost and Vice President of Student Experience in 2020. He has a Bachelor of Science and a Master of Science in Occupational Therapy from Duville College. He earned a PhD in Epidemiology and Community Health from the State University of New York at Buffalo School of Medicine and earned his school administrator certification from State University of New York at Buffalo. For fuller bios on each, please head over to our website, jeserie.org. And a special thanks goes to Dr. Ghosheh and Dr. Link for bringing this idea to the Jefferson team to explore here in conversation. Now, since this program is first airing live on the Jefferson Facebook page, we'll work our way through as many questions from you, the viewers, as we can as we host this event. If you have questions, just leave them below in the comment section. If you're watching a later broadcast of this event, please do feel free to send us questions. And for more information about upcoming Jefferson programs and publications, also visit our website and like us on Facebook and follow us on Twitter and Instagram and subscribe to our YouTube channel. Welcome panelists all. Thank you for joining us for this discussion. With the pandemic unfolding in 2020 and continuous impact in 2021, the last 14 months have been tough in higher ed for students, faculty, and administration alike. I'd like to each presenter to give us an overview of how COVID-19 impacted each campus and how each college responded to the challenge. Please also comment on the philosophy behind the responses chosen. I'd like you to ask first Dr. Link, and then Dr. Ford, and then Dr. Iwanenko.
Wonderful. Thank you, Angela, and thanks to everyone for being here, and thank you for having me. So I think I would start out by saying that those of us on the panel, as well as I'm sure everybody in the audience, would recognize that the past 14 months have been almost impossibly difficult, not only because of the global pandemic, but also because of the racial reckoning that at the same time has shaken our country, and certainly my campus at least, because of the political divisiveness that perhaps came to a head last November, certainly in our region, but continues to impact in many ways with a certain lack of often respectful dialogue on campus. And it's been challenging also for the financial strain for our campuses and for many of our students and their families. This is like a perfect storm in many ways, an intersection of challenges coming from many different parts of our world. And so it's called for an interdisciplinary approach in many ways to solving these almost intractable problems. And so when you asked about philosophy, the philosophy behind how we managed COVID, I thought that was a great question, because in many ways, the way we approached COVID at Allegheny College is really what we educate our students to do, which is try to approach different and difficult problems through multiple lenses. And so I like to think our approach was holistic and multidisciplinary or multifaceted in many ways. And just a few of those ways I'll list here. In part, it was how broadly we brought people to the table. So very early on in the process, right after we were forced to shut down in March and move completely online, we started in early April thinking through what our planning would look like for the fall semester of 2020. And we did that by bringing as many different voices to the table as possible. We had 12 different working groups, each of which was looking at an individual aspect of what reopening the campus safely would look like. We started with guiding principles, which were all about maintaining our diversity and access and making sure that we had equal access for all members of our community. It was about keeping our entire community safe. And it was really about building connections in our local community of Meadville that would keep the community beyond our campus safe, as well as keep us healthy. And so we brought it, as you heard in my introduction from Angela, my doctorate is in Renaissance Italian literature. And so while many of us, I think, would say we feel like we've become armchair epidemiologists in the last year, this was not my area of expertise. And so the biggest lesson learned, I would say, is just experts to bring as many different people from as many different viewpoints, walks of life, and areas of expertise as possible. So in addition to our 12 working groups, I pulled together what we now call ACHA, the Allegheny College Health Agency, which is a group of high-level advisors, some of whom are alumni, microbiologists, or disaster management experts, some of whom are local community members, emergency medicine doctors and nurses. We have an epidemiologist from Erie as well. And we also, and this actually is probably one of the more interesting pieces, we have a mental health expert, because one of the things that we recognized very early on is that the mental health aspects of COVID, as well as the racial issues going on and the financial strain, were in many instances more than many of our students were equipped to handle. And so the mental health issue became very important for us. And so again, our approach was all about keeping everyone safe and healthy, both from a physical perspective, but also from a mental health perspective. And I will say that, again, what we learned early on is that the strain on the mental health, not just of our students, but of their families and their parents, our faculty, our staff, and even people in the local community really heightened the anxiety and the frustration, and made it sometimes made it feel like we had to make decisions in the moment, but being able to step back and look at things from different perspectives was really quite helpful. Just very quickly, in the end, we were able to reopen for in-person living and learning. We're a small community with only about 1,700 students. We had 300 students opt to live at home and learn remotely, and the rest of them were on campus in our residence halls, living in person. But every class and classroom was equipped for high flex learning, so that in many instances, there were students learning at home virtually and students learning in the classroom. And I will say, having guest lectured in a number of classes this year, if you've never tried to teach both in person and online, it's pretty darn hard to do. So kudos to all of the faculty who made that work this year. And then another way that we really were holistic and multidisciplinary in our approach was about creating, we used the occasion of COVID to strengthen our connections to our local community. So neighbors to the college who initially were very anxious about having college students move back in last August, but we brought them into the conversation to make their neighborhood feel as safe as it could. The mayor of the city of Meadville, our county commissioners worked very closely with me throughout the summer. And the Meadville Medical Center, our local hospital, has been a tremendous partner and continues to be throughout the vaccination campaign. They lent us nurses who actually worked with us throughout the entire year. It really, I believe we're coming out of this with stronger community connections than when we started. And the last thing I'll say is that in the end, you can bring in as many perspectives as you want, but ultimately there's one person who has to make some really difficult decisions. And any president, any leader during the last year has had to make hard decisions in moments where we simply didn't have all of the information that we would have wanted to have. So I think for me, it was a year of a lot of really tough love and growing a really thick skin, because everything was new starting last summer. And you make the best decision you can, and you use the reasoning and the expertise of as many people as you can gather around you, and you march on forward. So I'll stop here to pass it on to the other panelists.
Thank you, Dr. Link. That was a very, it gave me an idea of what your community went through, and I assume there's a lot of similar colleges and communities that just had the same experience. So I would like to hear from Dr. Ford. How was it at Penn State Behrend?
Well, I think I could pick up very nicely at where Dr. Link left off, because I've often said if there was ever a scenario where you could just never even seemingly make a majority of the people happy with your decision or your decisions, this was the year. I mean, you just couldn't simply do it. A pandemic and something like this, it's kind of the ultimate hard to win situation. And when we go back and have this discussion, and thinking back a year, it's amazing to me how much we've learned and how much higher ed, all of the changes we've made. I actually think in the end, higher ed, when we look back, will be looked upon pretty favorably. Because you even think about some of the news stories. I remember the New York Times was actually calling us last fall to try to figure out our COVID numbers, and there was a great deal of concern about the catastrophe we would bring on by bringing our students back to campus. But I'll step back, as Dr. Link did, Hilary said in the beginning. I think one of the best things we did was, we knew that it was very important for our students' education that they have somewhat of a face-to-face experience. And then it became, how do you do that? So we put together, likewise, like many other institutions, just a whole number of task force here on campus. And I'd say if there was one thing that I did throughout the whole thing, or that we did, that was probably one of the best choices. And you had to look at, a tremendous amount that in hindsight, we've maybe even, I shouldn't say forgotten about, but we take for granted. We didn't know anything about testing. You go back a year ago, it was a mystery as to how you got a test. You'd take a test and it would take weeks for you to get a result. So all of us in our own ways have developed testing capability. And I know Gannon has a very extensive testing capacity on campus. We came up with a different solution where we have some vendors that we work with. We have testing capability. We have rapid tests on campus. So we've got like 3 or 4 things going on at a single time. I won't bore you with all the details, but you can walk into our health center and have a result now within a few hours, which is, to me, pretty amazing when you look at where we were relative to last year. But the big thing for us was really figuring out how do we meet everybody, and we developed a philosophy. It was actually Penn statewide. We said we're going to meet everybody where they are. And what was interesting was we ran a number of surveys where we asked our students whether they wanted to come back face to face. We asked our faculty and staff, and we started to see pretty consistently that about 75 to 80% of our students said they wanted to be face to face, or at least partially. That number changed as you got closer to the semester. I think there was a greater driver of fear during August of last year. And we asked the faculty as well, and we saw a similar result, although a little bit lower. And we actually just said to our faculty then, we'll let you deliver in the mode that you like, meaning fully face-to-face, fully remote, online, or something in between. And all of our faculty groups, go out and figure out how you want to deliver those courses. And I must say, I think we got a little bit lucky there, because it was pretty unknown as to what would happen. But we ended up, kind of ending, where our students were, which was a certain number wanted to come back face to face. You couldn't bring them all back to campus, and fill all of your classrooms, because CDC guidelines, distancing guidelines, just simply don't let you do that. So I like to explain to people that it turned out to be, it was about a third, and a third in the way we deliver our courses. About a third of those courses ended up being your traditional face-to-face. Traditional in that students are sitting socially distanced, they're wearing a mask, there's an instructor in front of the room. A third are a hybrid, partially face-to-face, partially online. And then the remaining third are remote, meaning they're largely fully online. And even there, the distinctions start to get blurred, because Dr. Link said you've got a faculty member delivering to students in the class and beaming it out to students who aren't in the classroom. So somehow we managed to do that last fall and through the spring. But if you have a laboratory, a laboratory intensive class, say you're in a biology, you've got to come to campus. So we gave priority to those. A lot of work went into figuring out how do you get people on and off campus? How do you, a big concern was, would people wear their masks? And what would you do if somebody didn't? And, what would all the disciplinary things be around that? I'd say, fortunately, mask compliance turns out to be pretty high. I know you hear a lot about it in the news, not trivializing it. I think it's sometimes, the reality is you see people in our society wearing them when they're supposed to. We see that largely on campus. I've had to tell one or two people, students, put on your mask, but it hasn't been the largest part of our experience. You also asked about quarantine and isolation. So, we had to take a residence hall and convert it to quarantine and isolation space. This was all very difficult. It sounds easy, but institutions of higher education are not public health institutions. Yes, we have a component of that, but we didn't know how to do contact tracing. You're disrupting people's lives when you call them up and say you had a positive COVID test. You and your roommates now you have the courtesy of going into isolation. We'll feed you as well as we can. We actually have a whole set of volunteers now who go up there every day and deliver care packages. Although, honestly, today I checked, we have one student in isolation. So we've had a very successful spring semester. But getting through that, I would say, was very painful. And, it will be like many of these experiences we have in life. All of us, in hindsight, it'll feel a lot better. It's starting to do so. And you forget the pain of what you went through. But all of us collectively have gone through something, and it wouldn't have happened. And I'll say the same thing that Dr. Link said, without really committed faculty and staff who deserve a tremendous amount of credit. And, there were just so many great stories of faculty members teaching classes, and, you hear the dog barking in the background, or they're taking care of their kids. But, it's all been working, and people have been very patient with it. They're tired of it now. They're looking forward to coming back face to face this fall. I think we all hear that. But I'll stop there. We could go on and on. We've all learned so much, a lot of similar experiences, but I know each institution has had their own philosophy. So I'll turn it back, Angela.
Thank you, Dr. Ford. That was very enlightening and informative. Thank you and your faculty and your administration for guiding this big community, several thousand students and faculty through these uncertain times. Definitely clearly a challenge here. Dr. Iwanenko, would you explain or recount how that was for Gannon being a city campus? And also, how did you handle testing, quarantining, vaccination?
Sure, I'd be glad to. And I think in the beginning, Dr. Link gave a great summary. There were other things going on in our environment, socially, politically, and then COVID's hitting. And if you think back in March, when we first started getting updates on the spread, December, January, February, to be honest with you, we weren't ready to shut down right away. We were looking at the numbers and we were tracking. We had 0 cases in Erie. This was one of the safest places you could be in Pennsylvania at the start of the outbreak. So when institutions were starting to announce their closure, we weren't announcing it. So I can tell you, my office received several calls from parents. Why aren't you sending my children home? And we were sending them, when we did close, we were sending them to places like Philadelphia, New Jersey, and New York City, where they had some of the highest rates in the country. So we were really trying to work with our local health department. I will say that's one of the health department was crucial in all of our decision making. And we were on the phone with them multiple times per week where we were trying to make decisions. And then ultimately the decision to close wasn't in our hands. We were told that we were going to close, and we all did shut down. But very similar to what we saw at Penn State and Allegheny, we did form a task force early on to start breaking down our needs, and we had several subcommittees. But as Dr. Ford said, some of the details, I know when I took the position, I didn't get the pandemic handbook. I don't think anybody else did. So now we were trying to make decisions like, okay, what is proper Zoom etiquette? And should cameras be on? Should we allow students not to have the cameras on? We developed for the spring semester, because it was this rapid transition, students were telling us, I was just getting used to my instructor, to my professor, to their style, to how they function. Then we had to go remotely, and this was a big transition, and some students did very well, others really struggled. So we developed a temporary pass-fail policy where students can opt to take a pass-fail. So that was something that we had to develop with cooperation with our faculty. And then we had students out on internships, and internships were canceled, field works were canceled, and some of the students needed these credits to graduate on time. So then we had many students that we just had to delay their graduation, because in some cases they just couldn't get the clinical hours they needed to graduate. So all of these issues were being mingled together. And I will say, flexibility was the key, because I know everybody else can agree that my Alexa's going off. I'll wait for this to stop. When we were making these decisions, we were asking people to do jobs that was not their primary position here on campus. So as Dr. Ford was talking about contact tracing, people shifted jobs, and we had to do contact tracing training, and we worked with the county. We actually housed the county contact tracing office on our campus. We had some extra space, and they needed to expand. We had to double the size of our campus health center, because we needed to bring on extra nurses to actually do our testing. And we were very lucky, because one of our VPs, Dr. Steve Morrow, actually has a biology background and had a research background in infectious diseases. I have an epidemiology background, so we were able to team up. He was able to set up our own testing. We converted one of our biology labs to a testing center. He started training students, and really early on in the process, he was ordering materials to be able to do our testing. So we were able to get a jump and put together a testing protocol that would allow us to get a turnaround time in 12 hours, which was unheard of at that time. I mean, it was taking sometime over a week, 7 to 10 days to get testing back. So this allowed us with our fall onboarding planning, which, as Dr. Link said, really started in the spring. When we shut down, we had to figure out, how do we manage remote delivery, and then how do we start to get ready to onboard students in the fall? That was going on at the same time. One of the great lessons learned was our ability to communicate. We started having campus-wide meetings on Zoom every 2 weeks. Not mandatory, people can log on if they wanted to, but every one of those meetings, we had 300 to 400 people on those meetings, just with COVID updates. This is what we're thinking, this is what we're planning. And then we would come up with a plan, and then the health department or the state would come out and say, we just changed the guidelines, and then we'd have to retool. So patience, staying humble, being flexible was critical. And it sounds like that was the same theme on all three of our campuses as we were working through all the details. So I'll stop there, and I'm sure some of the other topics will come up as we get some other questions.
Thank you, Dr. Iwanenko. Yeah, a lot of questions have actually around testing, quarantining, vaccination. Vaccination, we'll have another question about that, but thank you so much for giving us the overview, and kudos to everyone who has come out on the other end. I think we're looking a little more optimistic in 2021, but what an ordeal that was. And yeah, let's write that handbook. Maybe it comes in handy one more time. I hope not, but be prepared. That's the motto. I'd like to open the Q&As now. Dr. Ghosheh has the first question for Dr. Link.
Well, I guess the question could be for all of our panelists. You mentioned that you had to be agile and flexible and deal with changing conditions. Most of the students and most of the faculty would have preferred to continue with face-to-face learning. But having gone through this maybe a hybrid where some students went online, totally, some went face-to-face, some had the hybrid model. Do you notice a difference in the outcomes between students who went face-to-face exclusively, students who went remotely, and those that went hybrid? I don't know if you did any of the statistics and you studied this situation to see if the delivery impacts outcomes.
So I can start, and I'm sure the others will have something to add. It's an interesting question. We have not done a specific assessment within a certain class of students who did one version versus the other. What I would say, and I say this also as a parent of 3 children who were all doing various versions of in-person, hybrid, remote, this, switching all over. It really depends on the style of learner. And we heard this a lot from our students. And I don't know if at Behrend or at Gannon you found this, but one of the really interesting things for us was that students who really wanted to come back and came back in person because they wanted to be living and learning in person, in some of their classes, they actually ended up appreciating the online aspects. If they were going to break up into small groups, for example, it's much easier to do that, it turns out, on a Zoom breakout than sitting 6 feet apart when you're supposed to all be working to solve a statistics problem. So there were certain pieces of it that many of our students ended up surprising themselves and saying they preferred online to in-person. That being said, we're a small residential liberal arts college, and the in-classroom experience is why someone chooses to come to a place like Allegheny. And so even though our faculty, again, I think they were incredibly nimble, and I had older faculty who actually said to me, I think I became a better professor over the summer by incorporating items from Canvas that enabled me to really enhance the online teaching I would do. But at the same time, it's very hard to get away from the fact that being able to see someone, judge someone's body expressions, facial expressions, I think our faculty felt like they could really engage the students better when they were in person. But again, I think there are some students, I've talked to students who have said, I was surprised by the fact that I found online learning, there were no distractions. I wasn't overburdened by all these clubs and activities. I was only able to focus on my work. So there were some surprises in there as well.
Thank you. Anybody else wants to jump in? Dr. Ford, Dr. Iwanenko?
I can add very briefly. I'd say very similar. Now, we haven't done a study, and I think it's going to take some time to determine what the impacts are. You know, faculty were very creative, and we saw a similar experience. Some really came up with ways of reaching students and just adjusted their teaching in the online or remote environment in a way that they perhaps wouldn't have, and almost surely wouldn't have. You know, we know that people, for example, don't like to sit and listen to an hour-long lecture. And by the way, that's not what's always happening on our campuses. But I think there was a much greater appreciation in breaking this learning down into chunks, and you could then take the students and move them into smaller groups and the like. Repeatedly do hear, though, when you've got 30 students and they're, you know, you can't see them, you can't read their face, it's hard to understand what's going on and get that feedback. So that is definitely lost.
We have some initial data with a couple specific programs that have accreditation reporting obligations, and we did not see a drop off in performance, but I think the unmeasured variable is the lack of social interaction that really impacted our students' mental health. So the end result, we didn't see a drop off, but the process definitely changed. And I know my colleagues on this call, we're all concerned about retention. We have a whole class of freshmen. The only thing they know about a college university experience is what they just went through. And we're working really hard to get them back so that they can see our campus when we're in full swing.
Yeah, I have a question here that kind of piggybacks on this conversation here that, and I think you, Dr. Iwanenko, mentioned it, that some tracks require more in-person, they have labs, they have, Dr. Link, you're a language instructor. It does not, some classes can be totally taught online, others just you need the expression. Did you have any creative ways or any new ways to support these certain tracks that were more impacted than others? Maybe Dr. Iwanenko.
Well, I think the area we saw the most impacted were our health professions, labs, and engineering. Just like Dr. Ford said, faculty were able to take advantage of some virtual interactions that were available, some open source resources that were available. And in some disciplines, they actually mailed lab kits out to the students, and then the students would open up the lab kit so that they can actually get some hands-on experience, follow on videos. And then we had students taking lab exams via cameras, and the instructors would watch them perform the activities remotely. So a lot of creativity that went into it. Can't say enough about the flexibility and the determination that our faculty had to make this work.
I can add really briefly, almost identically, take your nursing program, it's got accreditation requirements, they need to be there. So you had to prioritize that, engineering or science labs and the like. So you saw very much the same thing. I think by the time we got to the fall, we were in a much more, we were in a much better place where we could plan for it. Whereas in the spring, it wasn't so easy. And I saw labs being delivered where a faculty member was very creatively showing what would be happening, say, in the laboratory, and you were trying to work with the students. I will say very personally, my student is my son, is a junior engineering student here. And so in the beginning of the pandemic, I was in one room. My wife's also a faculty member. She was in the next room at home, and my son was in the other room. So we got to observe him in his classes. And, so I would say it certainly has improved, and he's one who wanted to be here face to face. So he's getting that mix of classes, but you definitely saw the experience improve throughout the entire time. Not surprising.
Yeah, and I would just add, I mean, as a liberal arts, the arts and humanities, there were some real challenges. So as you mentioned, Angela, teaching language, especially elementary language, wearing a mask is impossible because students have to be able to see how the instructor is moving his or her mouth and what they're doing. So we, tried everything creative to clear masks with amplifying. We've looked at all of these. I would say one of the hardest parts were the arts. So our theater students, our music ensemble students, certainly last spring, those are the only courses that we simply couldn't continue because in the mad rush to go online, how do you figure out how to do a music ensemble? Again, they got really creative. I actually, just last week, I was walking into my office on the Allegheny campus, and our choral group was singing socially distanced outside my office. And so I think, again, we have learned so much. And at the beginning, it was sort of this paralysis of, well, here are all the reasons we can't do these things. And then we just all got really creative and said, well, we can't do it the way we have always done it, but what can we do? And so I think it has bred a sense of creativity and sometimes even whimsy that I think we wouldn't have been forced into.
Dr. Ghosheh?
I know. One of the questions that you all raise is the issue of retention. And I specifically want to focus on retention of international students. At the national level, most of our students, 50% of all international students come from two countries, China and India. That's not true at the local level, certainly not true at Gannon. Have you seen a drop off in international student enrollment? Do you expect that to continue in the fall? Are you willing to maybe be more flexible and adaptable, allow them to study online until they can get a visa and come to the United States? How are we dealing with international enrollment?
Would you like, I'll go first on this response. So we did institute flexibility. So we allowed students to enroll and start taking classes online while they were working on getting visas. We did not see a drop off with international students as we thought we would. International enrollment stayed rather steady. This coming fall, we were actually expecting a larger enrollment from India, and the current outbreak in India is really impacting our students' ability to get here. So we still don't know what's going to happen for the fall. But to your point, the flexibility was critical, allowing students to get started in their home countries and we had students actually onboarding throughout the semester. So some students started classes for 2 weeks, 3 weeks, 4 weeks at home, and then finished face-to-face. Some students were never able to arrive because of environmental conditions in their home countries.
And we certainly saw the same last year. We had some students who couldn't make it for fall. They came for spring. They came in the middle. But it's an interesting question because we have made the announcement that we are not going to be doing hybrid or high flex learning starting this coming fall. We're going back to fully in-person learning. But that does beg the question of, we know there are some students, for example, we have some students in China, although one of them just got an appointment yesterday. They're having a very difficult time getting visa appointments. Again, for Allegheny, it's a relatively small number of students. And to your point, Dr. Ghosheh, we have a very wide variety of countries from which our students come. So we have some students from China, but we have students from Mongolia, and we have students from Vietnam, and we have students from Ethiopia and Sudan. And so it's such a wide array that we just made the decision that we were not going to continue with the hybrid impact just because, as I said at the beginning, it is so hard. It is hard on our faculty. And I think that's the hardest part for the students when they're either in class or at home, but people are trying to do a little bit of everything. So in our instance, our international office is working individually with all of the students, and we're taking a wait and see kind of mindset, hoping that they'll all be able to get their visas to come, but also recognizing some may need to come in the spring as opposed to the fall.
And I'll add briefly, it's been a few hard years for, I think, all institutions of higher ed in the US, because there's just no doubt about it, let's say the political situation, geopolitical situation has been that they have not been coming here in the numbers that they have in the past. And I don't think we should, we shouldn't overlook that at all. And hopefully that will start to change over the next several years, because it's really an important source of talent, revenue, a whole lot for our country. That is quite important. It's a little hard to say. I'd say like the others this last year. The one anecdote I'll give you is, the other side of it was we had international students here on campus who couldn't get home. They were here living in the residence halls for a very long time, and we were delivering food to them, and so that was kind of a hardship that was overlooked. And they didn't want to go home because they didn't know if they'd be able to come back. But the same issues we're seeing. Yes, we have delivered to the students in other countries, and you had to get permission from their home countries, frankly, for them You know, in China, you can't deliver remote courses there. They don't let you do that. So there had to be an exception by the Chinese government, which was for everybody, not just for Penn State. But until that happened, we didn't know what we would do. We actually had some instructors in China delivering courses because Penn State was large enough. So we actually delivered some courses in some of the major cities so students could continue on. This fall, what we'll do for those that want to continue is deliver through our World Campus, which is an accepted way of delivering. So I'll just echo all of the other comments. I think, you know, part of your question as well, what's the outlook look like? I think it'll be okay this year, nothing great. I think it'll be the 2022, 2023 before we start to see a real rebound and the world return enough to normal that people can get their visas and they feel comfortable traveling and moving around the world. So it's going to be a while still.
Thank you. Yeah, that's indeed a very complex situation worldwide, and reminds us that, you know, we're all in this really together. So I would like to turn our attention towards the economic fallout or economic situation of students. And what have you been observing? What were effective measures against any economic impact, student loan deferment, state financial aid programs, state funding of higher education, funding of work-study jobs, or reduced tuition? Can you already see what has been really effective, or is it too early? There's no data available yet.
I would say yes, and you know, the financial strain is real. Our discount rate will end up going up, frankly, in the next year, just because our students have need that many of them didn't even have. One of the big ways that we have addressed this, we have something, Allegheny's mascot is the gator. So we have something called the Gator Success Grants. And, you know, those are basically micro grants that students can apply for. But the extent to which they were used and applied for this past year was beyond anything we had ever seen. So everything from books or clothes or meals during vacations, if we had students, you know, who couldn't get somewhere, or housing, even for a week or so. It was sobering, frankly, for us to realize. I say all the time, COVID didn't create problems from nothing, but what it did was pull back the layers and reveal all the cracks in the foundations of what our system of higher ed has kind of lived on for centuries. And, you know, the rising costs and the sacrifices that families have to make to send their child to a school like Allegheny, the disparity among our student situations, right? How many times did we see that with students not even having, that happened a lot with when we had to send everybody home, students not having technology. They didn't have Wi-Fi. They didn't have their own private space where they could learn. So I feel like everything has kind of been revealed. And now, of course, it's incumbent upon us to try to figure out the ways forward. So to go back to your point, we've really tapped into a lot of that. Higher financial aid and a little bit more leniency in students having, you know, balances on their bills and giving them access to these micro grants and state funding and federal funding and you name it.
Those are busy times for the bursary and anyone. I'm sure very busy times. Anyone else would like to share?
I'd add a little bit too. Yeah, we've seen an awful lot, and you know, our executive vice president of the university essentially has said, you know, if you ever had rainy day funds, it's raining, you know, and I think what you've seen in higher ed is we've looked for every bit to provide aid, and you know, it has come in the form of hardship funds. So all of us have hardship funds, and the stories you hear from the students sometimes really are, as Dr. Link said, quite significant. They don't have the technology at home. They don't have a lot of things that we might take for granted. So it's been really nice to see people philanthropically stepping up, but that certainly I won't give the impression that that was enough. The federal funds have been really significant. 50% of those funds that you see that come to each of our universities have to go directly to the students in the form of aid. That has been helpful. I think without that, it would be far more difficult for our students. We're all starting to see some rebound and more optimism than we saw last year. But boy, you go back to last summer and it was just a very different situation. I'll just add, one of the things that we did was something really simple. Was if you had an internship job, if you had any job on campus, we just tried to honor that no matter what you were doing. I was really big on just find work for the kids to do. We've got the money set aside for the semester. Make sure that they have some way of working remotely, no matter what it is. It's a form of income. And there was just a lot of that thinking to get us through.
And a lot of the same, we were really trying to leverage the federal funds and get them into the hands of the students that needed it the most. Gannon has committed to this upcoming school year to a 0% tuition increase to try to help our students and families the best we could. But as with all of our institutions, it's tight, and we're all trying to recover from what's happened over the last year.
Thank you. That was a tough question. And the next question, Dr. Ghosheh, is also not an easy one. I'm sorry.
Well, there are no easy questions in this case. It's all complicated. Probably one question that most students and families are concerned about is, will you require vaccination for students to return to campus in the fall? And if the answer is no, how do you deal with a classroom where you have some vaccinated students and some unvaccinated students?
I'm happy to go first if you want on this one. The answer is, as of right now, Penn State has said we're not going to require vaccinations for our students. I will tell you, our board, is meeting this week. That could change. So I'll try not to speculate too much, because I really don't. There should be nothing read into that comment. I'll say personally, my original thought was you really couldn't require vaccines for students this fall. I think that's changing. And my viewpoint on that was fairly pragmatic. We didn't know if there would be enough vaccine supply. Now we have learned that there is. I think you'll see more and more universities requiring it. Understand that when you require it, there's always, students can opt out based on religious beliefs or whatever else. So that would likely remain in place. What we find with other vaccinations is you get to about 80, 90%. So I would argue that would still be a pretty good number for us to be at. I'll maybe give it a little more pragmatic thought. First of all, the vaccines that have been developed are a modern scientific marvel. We just cannot understate how many bad things, a lot of things have gone poorly in the pandemic. It really is. And I know that everyone may not agree with that statement. They are safe, they are effective, they're developed using a mRNA platform technology that hasn't existed before. We would not have that without modern research and development. So I'll put that plug in. If you haven't got one, please, get one. You're doing the world a favor by doing so. We already know about 80 or 90% of our faculty and staff are vaccinated as of today. We've done some surveys. We've really done everything we can. And what we're seeing anecdotally with our students is the uptake is pretty high, we believe. We don't know for sure. So we just want to continue that to happen. So to answer your question for the fall, it's one of those uncertain places. We don't, I can't tell you what it's going to look like on fall in our classes on campus this fall. Will we require masks? We don't know. What will the distance be? We don't know. But the best way for us to get from here to there is to get people vaccinated. End of story. So get vaccinated, people. Anyone who's listening.
Yeah, and so we haven't announced one way or the other. I have a feeling most institutions, by the time we are getting ready to reopen this summer. We'll be requiring it, but with religious exemptions or health exemptions, personal exemptions. I love to tell the story going back to what Dr. Ford, I think, was saying, that in the scope of, right, you can't please all the people all the time. This has been, again, it's almost like a daily occurrence that you can't please anybody ever. So in the course of the last couple of days, I have received emails, both I like to say yelling at me through email of, you must require the vaccine, and others saying, if you require the vaccine, we will sue. Okay, so, where do you go? I think, honestly, more and more, if you look at the Chronicle of Higher Education, the list is getting longer and longer. But some of us just are not quite ready to announce it yet, although I think we're probably moving forward toward that, only because we've tried the incentivizing, and we will continue with incentivizing. If you're vaccinated and you're exposed, you probably won't have to quarantine. And for our students, not having to go into quarantine and get the food that they never say tastes good is a really good thing. Or for our athletes, the NCAA has really put out some pretty strong mandates. And so for us, we're telling our athletes, if you want to be on the bus traveling with your teammates, you're going to need to be vaccinated. So I think between kind of cajoling, hopefully not coercing, but really moving toward that, we're seeing about 60% of our students right now have opted in. We know about 94% of our faculty and staff had opted in earlier in the winter. So I think things are just changing so quickly. As Dr. Ford said, we've all learned that you can't even predict how things will shift in the next couple of weeks.
Our numbers are similar again, and I wouldn't have anything to add. We're all having the same exact discussions on our campuses.
Thank you so much. I think encouragement and maybe by example, all your friends are being vaccinated, you're being left out. I'm going. I think that's how it works out often. I'm going to have just one more question for everyone. And I want to have more like a, post-pandemic outlook. What does post-pandemic academia looks like? What are lessons learned? I know we mentioned it several times that actually students have discovered that working online has advantages. So is that something we want to keep or add to the curriculums or make available to students, maybe in some tracks more than others? So please share what you think remains in a positive way, in something we've learned. Any impacts also on faculty and training in general, education in general.
I can take this one first. I think the discussion between flexibility and accountability are at play. So how do we provide students with the flexibility of utilizing remote learning when they need to, versus not having a free-for-all and keeping everyone accountable to the fact that we want you in the classroom, and we still are committed and believe strongly that that's the best way to learn, is to be in the classroom.
Sure, I'll be happy.
Go ahead.
Yeah, one of the things that we've learned is, there's a lot of pressure to say, why do universities have the brick and mortar structure? And the truth is that, a lot of our college age kids, they do need that environment. But I do think that this has shown that we still need that. That isn't going to change. I don't think, the human experience has changed that much over the last year, but we're a lot more adept and flexible. We already had a fairly large number of our faculty who were teaching on our world campus, so they're pretty adept at putting courses online. But we just moved a whole group of people, not intentionally, but through, necessity, a lot of our faculty are now able to deliver in a far more flexible way. So I think you'll see more flexible work arrangements, you'll see more flexible delivery of classes, but you'll still see a lot of the traditional things that are out there. We certainly have gotten a lot, universities have found that they can, again, reduce costs just that one more level that they haven't been able to in the past. And where it'll all end up, I don't know, but I think in the next couple of years, it'll look similar, but we'll be more flexible in terms of the way people, our faculty and staff, have more flexible work assignments. It's hard to get people sometimes here to Northwest PA. We may see more of our faculty and staff working in other places.
The only thing I would add, I agree with what both of you have said. And, the flexibility, again, the accountability in terms of holding our students and our faculty, obviously, to the highest standards. But I think one of the really big takeaways for us has been, and this is not just about our students, the lack of a sense of community that our faculty, our staff, my administration, that we feel really strongly. And so I think, one of the things I've spent a lot of time thinking about and really puzzling through is, what is the role of a community of scholars when you think about education? We talk about education and we think about, can it be online? Can you deliver the same content? But the human interaction is so important to how you form ideas, and forming ideas with other people that shifts how you approach them. I think, and I say this in part as a humanist, right, who looks at things from so many different angles, but you can obviously connect with people on Zoom, but a real sense of building relationships and communities is just not as easy to do. And I think I wouldn't have said that was quite as big of a piece of who we are as an institution as I think we've learned it is.
Thank you. I think these are experiences that a lot of workplaces have found out, that while it is possible to work remote, it is bringing results in many professions. The sense of belonging is quite important, and especially after all these months now being remote, being isolated, then I think you will see a surge back, and students want to be students, and faculty want to know their students, want to interact with them. But there's maybe parts that after we've enjoyed that first company again, then later on it's like, hey, we did this once a week Zoom, why should we not do it again? So it could come back in some practical ways. That's what I'm saying here. So I think we've covered a lot of questions here. Thank you so much, Dr. Link, Dr. Ford, Dr. Iwanenko. Thank you for sharing your knowledge and expertise, and for taking the time, energy, and effort to share them with our constituents, with our patrons, and the Erie community. Dr. Ghosheh and Dr. Link, thank you again for bringing this idea to the Jefferson digital stage. I really appreciate that. And to all of you watching along at home, thank you for tuning in. And just a friendly reminder to stream other programs, just head over to our website, jeserie.org, where you find this program being streamed again. And you find also details about upcoming programs. The Digital Summit is coming next week with a whole array of very interesting speakers of national and international recognition. There we have publications, quick timely reads, reports, or essays free for download as well. For the Jefferson Educational Society, I'm Angela Beaumont with co-moderator Dr. Ghosheh. Thank you very much for joining us today, panelists. Be safe, be sound, and thank you for listening and learning with us.
Thank you.
Thank you.
Thank you too.